Broadway is dark tonight. It's a little bit weaker than you used to be. Broadway is dark tonight. See the young.
15 years with experience devoted entirely to treating breast disease. She is the visionary behind Good Samaritan's Center for Breast Health, and we are very happy to have you here today.
Thank you.
Thank you for joining us as I turn to page 6.
You may not recognize me since I got my haircut.
I did recognize you since you got your haircut, and I have to say, when I was introducing a doctor, I didn't think I'd introduce one as fashionable and as trendy as you.
Well, for those of you who don't know me, I don't own a white coat. I never wear a white coat, and this is what I wear to the office.
No, you don't look like white coat material,
No.
So tell us, you are a highly skilled physician and board-certified surgeon. You're known among your patients and colleagues for providing exceptional and compassionate care. We're happy you're here, and we want to know, what advice would you give to a woman who is considering surgery to deal with breast cancer?
Well, I'm going to backpedal on that a little bit. Because first of all, we do this every year. Now, this is the first year that I've been here. I was at Cornell in Queens for 11 years, and I was at those breakfasts, which were not as nice. But anyway, and so I'm very happy to be here in Hudson Valley, and this is an awesome turnout, and everybody should sort of clap for themselves for being here. So let's hear some thank you. But as much as what you asked me is important, the thing that I really believe in is patient advocacy. And what I mean by that is that breast cancer is terrifying. I don't really need to tell everybody in this room. And the stories of survivors are incredibly moving, and they touch all of us. And I love what I do because most of my patients, I can cure them and I can see them as they follow up. But the thing that I would like people to learn is that as scary as breast cancer is, and the first time that a woman is told she has breast cancer, she usually doesn't hear anything else after that, is not to rush into anything, because it's such a scary diagnosis and there's so much pressure to be treated that a lot of women find themselves making a decision that maybe they will regret later. And I frequently recommend patients get a second opinion, because I want them to feel comfortable with the diagnosis and their treatment, because it's very scary to say, it's kind of natural if someone says to you, you have breast cancer, to say back to your doctor, well, can I have surgery done tomorrow? And the reality is that nothing's going to happen in that time interval. Between the time that you sort of get your head around this diagnosis and talk to and gather your support system, which is really important, nothing will happen. And that's been documented by lots and lots of research. So it's important that you understand what your options are. And if your doctor isn't listening to you, isn't making eye contact with you, isn't answering all of your questions, find another doctor. And I would say that across all of medicine in general, but surgeons are especially known for being short, not having the greatest bedside manner, being kind. But anyway, the point is that, so when a woman comes to me, and I have to tell her she has breast cancer, which is not easy, and it hasn't been easy even after 16 years of doing this, I give her options. And most women today can have breast conservation therapy if that's what they want, which means they don't have to have a mastectomy. Very few women need to have a mastectomy. Now, having said that, if a patient desires that, that's her choice. Because, and a lot of patients will say to me, well, what would you do? And I'm like, I'm not you. I don't know how you feel in here. I don't know what your relationship is like with your spouse or your significant other. I don't know how your view of your own femininity and your own sexuality is going to be affected by this, and that is too personal. So I will not make that decision for my patients unless I'm forced into it for the few people that do need to have mastectomies. So my advice is to be your own advocate, which is sometimes very hard to do, especially when you've just been told something that's incredibly terrifying. So I tell people to take a deep breath. I give them a lot of information, and I tell them to go home and usually have a drink. And then when they're ready, to start to read through some of the information that I've given them and start to decide how they want to move forward, because it's a process, it's a journey, and it's not a race. And the object is to get to the end, but the right way. And the right way means that you are with a doctor who's caring, who listens to you, who is going to listen to all the other things that a lot of doctors don't think is important, like what's your relationship like with your kids, and what work do you do, and how are you going to handle all that when this is happening. So I know this is a long answer, and I apologize, but I think that it's really important that women not panic when they're told they have breast cancer, which is a sort of a natural reaction, and run to Sloan or run to one of the other hospitals that's, you know, supposedly the best in the world or whatever, because the reality is that we can treat this disease right here just as good as they can anywhere else. And you have to take your time and rely on your support group and your instincts to do what you think is right for you.
Wonderful, wonderful answer. Another question, right? Great. And you have to, when you're diagnosed with breast cancer, you have to all of a sudden put on a lot of hats. And one of them is to advocate for yourself. I get that. Educate us a little bit. I learned today about the Road to Recovery and the Hope Houses. Tell me, are there any new advances medically that we should know about?
Well, one of the reasons I like what I do, besides the fact that I get to have a lifetime relationship with my patients, is that breast disease changes about every 3 weeks in terms of treatment options. Something that was true a year ago may not be true now. Something that was available a year ago, not available a year ago, may be available now. So, just to give you a few things that are new, there is something called a mammotomosynthesis unit, which was FDA approved about 6 months ago.
A mammotomosynthesis. Tomosynthesis.
And what it is it's a CAT scan for the breast. And how many, I'm just gonna do this because I know I'm gonna get a lot of hands on this one. How many of you have ever had a mammogram and told that you have dense breasts? Wow, imagine that. Okay. So that's a problem, because if you have dense breasts, it's harder to read a mammography. And so the fallback position that a lot of radiologists are doing is they're saying, we'll get an ultrasound. Well, an ultrasound doesn't always pick up everything, and it's very hard to do a screening ultrasound. A mammotomo unit scrolls through the breast like a CAT scan, and it doesn't matter how dense your breasts are, you can see everything. Now, it hasn't been set up anywhere in the country yet. It's brand new. The only place that has it, as I know, is Harvard. I know there's some places in the city that have ordered it, and I'm trying to get it here, because it will change all those lovely callbacks that you get when you feel like you're going to throw up when you get that phone call, and it will change the ability for us to detect breast cancers in women who have dense breasts, who don't have dense breasts, across the board. That is a huge thing that has just been approved by the FDA.
That's wonderful. My last 3 mammograms, I had to go back for the sonogram. So we're happy to have this. All right, Dr. Karen Karsif. Does anyone have a question for the doctor? I think we could take just one. Anybody have a question? I know I'm putting you on the spot. It's a live show.
Wow, no question.
All right, well, tell us then where we can find you, because I'm sure there'll be questions later.
Well, I have been, for the last 8 months, the director for the Center for Breast Health at Good Samaritan Hospital in Suffern. And my number is 845-357-7462. When I came, I was asked to build a breast center from the bottom up, which I have done. Not done yet. And, but I have with me my genetic counselor, Vanessa Marcel, stand up. And my patient navigator, Annette Gonzalez. And because this disease is scary, and it requires a lot of points of attack. And one piece that I'm not going to go into because Vanessa went into it, last week, is about genetics. That's something that most breast cancer is not genetic, but some of it is, and we need to have someone around who can handle those women who do have a family history suggestive of genetics. So I'm in the process of building this, and with a lot of help from the hospital, and I'm very happy to be here.
Dr. Karen Karsif, we haven't met a lot of doctors like you, but we're really glad you're here in the Hudson Valley.
Thank you. I'm really happy.
Thank you very much. All right, we're going to take a break and hear from some more.
Burn the town.